Obesity remains a significant public health concern across the United States and other economically developed countries, according to the Centers for Disease Control and Prevention and the World Health Organization. While exercise is often emphasized as a solution, new findings suggest it may not be the primary factor behind rising obesity rates. It's a mix of poor diet, high stress levels, lack of muscle and lack of frequent movement, Lindsay Allen, a registered dietitian nutritionist, explained to Fox News Digital. Although overeating and lack of physical activity are both commonly cited, new research points to one of these factors as having a much greater impact. A team of scientists examined more than 4,000 adults from 34 populations. Researchers measured each participant's total energy expenditure, body fat percentage and body mass index to better understand the link between energy use and weight gain. The differences in body fat that we see across populations likely aren't due to major differences in activity level or total daily energy burned, study authors Amanda Magroski and Amy Luke told Fox News Digital. Rather, excess body fat is likely primarily the product of too many calories in, or eating more calories than are burned. Notably, individuals in wealthier, industrialized countries burned more calories, but researchers say this was largely due to higher body mass. Since heavier individuals naturally use more energy, the increased calorie burn didn't translate to lower obesity rates. Published in the Proceedings of the National Academy of Sciences, the study concludes that food intake plays a much more significant role in weight gain than physical activity. Our analyses suggest that increased energy intake has been roughly 10 times more important than declining activity rates in driving the modern obesity crisis, the authors stated. In light of the findings, experts say the focus should shift to diet, particularly the consumption of ultra-processed foods, as the primary target in preventing obesity. If you're worried about excess body fat, focus on calories in, Magroski and Luke suggested. Especially over the long term, it's much harder to meaningfully change the total number of calories you burn than it is to change the number of calories you take in. Echoing the study's conclusions, Dr. Brett Osborne, a Florida-based neurosurgeon, emphasized that the issue isn't lack of movement. It's the constant stream of ultra-processed, nutrient-void products being shoveled into mouths under the guise of health or convenience, he elaborated. And it's killing us, slowly, predictably and en masse.